We are just over a month out from the most recent portion of Michigan's no-fault auto reform bill going into effect.
Advocates said warned that the changes could cut off crash survivors' access to very important medical services, and now that is happening. Fox 17's Michael Martin is live in the newsroom with the latest on this situation. Michael.
Yeah, Doug, Janice, we've hit this story over and over again because for many of the people that we're speaking to who are in the process of losing access to medical care they badly need to survive, this is a matter of life and death. Over 16,000 people, in fact, rely on no-fault auto benefits, and advocates, they say the situation is getting worse every day.
This is just starting to crumble all around us.
We are just over a month out from July 2nd, the day 16,000 survivors of catastrophic auto crashes in Michigan had been fearing for months when the latest portion of our state's no-fault auto reform law took effect.
People were just scrambling and trying to figure out what was going on and what would happen.
Peg Campbell has long advocated for her sister, Barbara Scowen, who was badly injured in a crash years ago, now a university-level associate professor.
There's a thin line between life and death for many of these people.
The latest changes introduced a new medical reimbursement fee schedule for local care providers, meaning that insurance companies are now obligated to only reimburse providers for services like in-home caregivers at 55% of what they were previously being reimbursed for back in 2019.
41 agencies have terminated their no-fault patients. They've either gone out of business or they just can't absorb the pay cuts.
Meaning survivors like John Wick of Lansing, who has long been able to live at home because of his caregivers, now can't find companies willing to take him on as a client.
They don't want to take him if there's going to be a 45% reduction in their pay. And because he requires 24/7 nursing and 24/7 home health aides, I mean, I guess as a business owner, it's a risk.
Fox 17 first spoke to John back in June before the reimbursement cuts took effect. At the time, he was hoping he would be able to continue to receive care from his home.
Nobody can give me an answer as to what'll happen.
He needs caregivers 24/7 to survive, but was discharged by his previous care company on July 27th.
If I'm stuck in the hospital, that means there's no coming and going as I please.
Winding up now exactly where he worried he might, in the hospital. His case manager, Sonia, desperately trying now to come up with some sort of concrete plan moving forward.
And it just makes me angry that we are putting people in a position where their independence can be ripped away when he's already had so much ripped away from the auto accident.
They have found a facility willing to accept John for the time being in Lansing, but the future of his care and the care of the other roughly 16,000 Michiganders remains up in the air. As Michigan-based providers close their doors, lawmakers have failed to act on any of the bills introduced prior to these changes going into effect.
Like, at what point did we stop caring about him?
Lawmakers did end up creating a $25 million fund to help buoy care providers who stay open and can prove the cuts are hurting their finances, though applications to get some of that money, being handled through the Michigan Department of Insurance and Financial Services, won't open until August 13th. Advocates say it simply won't be enough to stop many providers from having to close their doors.
The lawmakers are the ones who have the key. And our top legislators are not listening.
Yeah, and so again, no legislative fixes were taken up prior to the legislature's summer recess, and the $25 million fund has been deemed by advocates as woefully insufficient. The hope now that lawmakers will see what's happened with survivors and what will continue to happen and to their access to care and, well, hopefully act once they return to session. For now, though, live in the newsroom, Michael Martin, Fox 17 News.